it started, she had bronchiolitis, and then Penelope had a convulsion, and then it's
Come on.
been horrible. I'm sorry.
Oh, it's all right, Mum.
I just feel like...
I lost my wife.
Oh, bless you.
Then 10 months later,
Yeah.
I lost my youngest son.
Oh, no.
If it's painful at all, you need to let me know, okay, and I'll stop. Is that painful?
Yeah.
That's painful.
Yeah.
Oh, has Dolly hurt their head too? Yeah, I'm Molly. I'm one of the student nurses. Do you want to come with me?
I must have been about 2. There's a photo somewhere and I'm dressed up as a nurse. And my little sister, bless her, used to get covered in bandages and plasters and you're the patient, lie there. This is what I'm doing now.
5-year-old Skylar has a head injury, so she's seen immediately.
What did you do to your head? You want Mummy to tell me?
Brother picked her up and dropped her and she's banged her head on a bed frame.
Oh, no.
After initial assessment by Molly, Skylar's given the once-over by junior Dr. Tom Fish.
My name's Tom, nice to meet you.
Yeah,
Who have you brought with you today?
Baby Lucy.
Oh, baby Lucy. You got a poorly? Oh dear, it looks sore. Is it sore? No. Oh, that's good. You've been very brave then, aren't you? Let's have a look. So I'll be hopeful that we might just be able to put like, a little steri strip over it, just close it together. You may well get a tiny little bit of a scar, but it's kind of hidden in the eyebrows, isn't it? So it should be okay. All right, sweetheart. I think it'd probably come together with a steri strip if we could try that first.
Yeah.
Are you guys
do it? Yeah.
No worries.
Hello. Shall we put a stick on your little cup? Yeah?
Right. Can you lie down on here for me, please? Thank you. You're going to put your head here? Ah, you're so clever climbing up on there. Because what you'll do, if you pull it, you'll pull the scab off.
You're not even ticklish. Molly is.
I'm very ticklish. You can't come near me. I'll just burst out laughing. Right. Let's just give your Paulie a little clean.
I'm just going to clean it.
Oh, well done. Oh, you're doing ever so well. You're giving it a good squeeze. See, I'm going to squeeze it to see how well it comes together. It's not going to come easy. Ready, sweetheart?
Good girl.
It's okay, baby. You've been really good.
What are you going to do when you go home? Do you know?
A Chinese.
A Chinese food show.
There we go.
Little bit of glue. And then we've got to do Lucy, haven't we? Yeah? We're nearly done.
When you're talking to a child, you can talk to them about anything. Just pretend that you're their friend and get to know them. And then all of a sudden you've got that connection with them.
Right,
Should we do
sit up then,
Lucy?
and we'll do Lucy. I'm gonna hold her hair back.
There we go.
I'm gonna put one here like yours. There we go.
Then you'll have to give Lucy a big cuddle, won't you? Yeah? Right, then Mummy give you a cuddle, you give Lucy a cuddle. Oh,
There you go, you're
God.
twins now.
You get to go home now. And maybe have that Chinese. That's it done. Bye-bye.
I think the most rewarding thing about working in A&E is when you get to see that patient go home and they're smiling.
87-year-old Ken is in a bad way.
Ken came in today because he'd fallen over and he'd bumped his head.
I managed to fall down and bang.
Student Dr. Saba Azizi treats Ken's head wound under the guidance of Dr. Jonathan Hobbs.
It's just going to sting a little bit when I'm putting it in. We'll make the place nice and numb, okay?
Yeah.
You got my hand if you want to, okay? Squeeze that.
The first step is to numb Ken's forehead.
This is the worst part.
Alright, well done.
Okay, that bit's done.
Worst part done.
We're just going to wait for a couple of minutes, okay? Get set up and then we'll start with the suturing yourself, okay?
Yes.
While student Dr. Saba begins stitching, Dr. Hobbs keeps Ken distracted.
What would you be doing if you weren't here, Kenneth?
Watching sport on television.
What sport are you watching today?
I like tennis.
Oh, yeah?
Recently.
It's been good, isn't it?
Yes, it has been very good. Eh?
Alright. Can you feel this?
No.
A few butterfly stitches later,
But those are all the stitches in.
Very good. Excellent.
It's looking good. Well done.
Look after yourself as
Remember you in my will.
See you later, thank
See
you.
you then. I hardly felt a thing. She was good.
High praise for student Dr. Saba, but Ken still needs treatment for the wound on his cheek.
Hello.
So,
How are you?
I'm all right, thank you.
Right. Can I have a little look at the other cut that you've got on your head?
Ken's had stitches in his forehead after falling at home. Now Sister Amy's arrived to treat the wound on his cheek.
Right. Let's give you a good clean up, and then if I can glue it, I'll glue it.
Right.
And if not, we might have to put a couple of little paper stitches on, if that's okay with you.
Okay, yeah.
You look like you've been on a horror film. I'm not prodding and poking your bits that are open, I'm just cleaning your face first.
Right.
Make you look as if somebody loves you. What have you bumped your face on?
The floor.
Oh dear. But you'll have to get some cushions and tape them round your head.
I know. Exactly.
Next comes some paper stitches.
It's like a little flacky bit. There you go. Go. Much better. Ideally, I would rather it not have a plaster on because it'll heal up better.
Oh, that's
But
I'll be
I'll
careful.
put you a plaster on just so that
Careful.
you can put your glasses on without knocking it.
Right.
But when it starts to peel off, you can take it off.
Right.
There you go. You should be able to get your specs on now without knocking it. That's it. There you go.
Just,
Ken didn't feel a thing
it's the best anaesthetic that I've ever.
and was home in time for the end of the tennis. Matron Val's next patient is Horace.
Hey, you well. She never raised very paws.
He's in a lot of pain after falling at a friend's house.
How are we doing? Good man. So normally, if you break your hip, normally it comes up and it goes out.
I know it's really painful.
Do you have you had anything for your pain?
Well,
You've had some paracetamol for your pain.
Yeah.
So do you think you'll be okay until after your X-ray?
I might manage.
No, maybe not. Shall we have a smidge of something a bit stronger? It'll be akin to having a few whiskies. That's not a bad thing.
I don't drink.
Oh, okay then.
I don't drink. I don't smoke. No bad habits.
I haven't got any bad habits either.
I lost my wife.
Oh, bless you.
Then 10 months later,
Yeah.
I lost my youngest son.
Oh no. How did all of this happen?
Well, she'd been disabled for bloody donkeys, didn't she? She had chest problems, breast cancer.
Oh, bless her. You've been through the mill, you, my love, haven't you?
Well, I got through it.
That's the thing, we do, don't we? But it doesn't mean that it didn't hurt when you were getting through it.
It bloody did hurt.
The most important part of my job is to be able to make somebody feel like I'm listening to them.
Now, how long ago was that?
Well, it's 8 years.
I am sorry, that's such an awful time for you.
It was.
It's 2 minutes or 3 minutes out of my day, but actually it's a huge thing to somebody like Horace for me to stand there and have a chat with him and let him just let out of his heart what's up with him.
Why would you step on my nose?
You've got, that's perfect. So there's a little bendy bit here, right? And I'm going to put the bendy bit there. Now it might stay on your nose.
I know I have a big nose. Is that why it stuff?
I don't think you've got a big nose. You've got a distinguished nose.
She's a good liar, isn't she?
Distinguished. I'm going to request your X-ray,
Yeah.
and then we'll get you round for an X-ray, and we'll know if you've damaged this hip. Okay?
Whose cat were you looking after?
Next door neighbours.
Yeah.
I went to the back door. I just looked over the fence, see if I could see her.
Yeah.
She weren't there. I just turned round, come back, walked towards, went back into the room. Next thing I knew, I was off the floor.
You're on the floor, yeah. Yeah, but you didn't bang your head.
No, I didn't bang
That you remember, there's no
that
sores.
leg cop to toe.
Yeah.
That knee.
And I mean, I know you fell from standing, but you are quite tall, so you probably could have hurt you. Yeah. Ah, yeah.
I love Jasmine to death. Her interactions with the patients is just, it warms me. You can't teach somebody to care and you can't teach somebody compassion. You've either got that or you haven't.
Yeah. I'll be back in a few minutes. All right.
Okie dokes. Yeah, I'm fed up.
I wanted to be a nurse since I was about 18, 19. It was in my second year of uni and I was talking to an elderly lady. That was definitely the moment where I realised talking to elderly people about their troubles at 1 a.m. in the morning it's actually a nice career.
Nurse Jasmine takes Horace to X-ray to discover if he's broken any bones. She's the first to see his results.
Can't look at ECGs, can't look at X-rays. It's just white lines and clouds with the chance of a little bit of rain later on. I'll get doctors to have a look at it and then we'll let you know if you can have a cup of tea. All right. You know when you go and bring a cup of tea to an elderly person and you just made their entire day just from a cup of tea, because tea makes everything better, doesn't it? Especially when you're in Yorkshire. Ta-da! Pop it on.
With Horace now refreshed, orthopaedic doctors Hannes Salib and Gunnar Patcher take a look at his leg.
Okay. Which leg is painful? Which one?
This one. That's about
That's fine. Okay. When you're doing that, where do you feel the pain?
Right up here.
Can you wiggle your toes for me?
Just.
So you had some X-rays done. We cannot see an obvious fracture or break in the bone.
X-rays are
So we're ordering more investigations, more X-rays and scans to see if there is any subtle breaks in the bone, and we'll take it from there. Okay, sir?
Yeah.
Once we have the results, we'll let you know what's happening. Any questions for us?
Nope.
Okay, sir. Okay. Okay, all the best for you.
As long as I get put back together, I'm not bothered.
Luckily, nothing was broken, but his knee has taken a major battering. Horace stayed in hospital for 2 days. He's now home and keeping an eye on the cat from the safety of his window. As a patient is being rushed in after falling and hitting his head at home. Advanced clinical practitioner Chantel takes charge.
Hello, my love. Is it John?
Yeah.
Tell me a story. What's happened?
I got out of bed this morning.
This morning. Okay.
Perhaps.
Did you feel dizzy or anything, or did you trip up over something?
Well, no.
Did you have any headache or anything?
No.
No. Any chest pain?
No.
No. And did you feel unwell before you collapsed?
No.
You hit your head on the desk, is that right?
Yeah.
On the desk, okay.
To complicate matters, John's got diabetes and a cancerous growth on his cheek that's also been hit during the fall.
I've had a look on your medical history, and you've got a cancer on your face, haven't you?
Yeah.
Okay.
He's got a cancerous lesion growth on his face called a squamous cell carcinoma.
Radiotherapy.
You're having radiotherapy?
Yeah.
Okay.
There's a bit of trauma to the surface of the lesion, and there was a lot of dry blood around there.
And you've got a lovely bump to your head now.
Yeah.
Can I have a look at it? Is that okay?
Yeah.
I just want to see if there's any fractures or anything, if there's any arterial bleeds that I need to sort out before he goes to CT. And his eye looked quite swollen. So I want to make sure that his eyes are okay and that his movements are all right. Are you ready?
Yeah.
If it's painful at all, you need to let me know, okay, and I'll stop. We've got a lovely gash to your head.
So I don't really get shocked anymore with injuries. Nothing really phases me anymore. But it looked quite a nasty big cut on his face.
With such a heavy fall, John might have damaged his eye muscle, so it's important that he gets assessed thoroughly.
A good chunk. Well, at least I can't see your skull, so that's a good thing. You've done a good job, though. Is that painful?
Yeah.
That's painful?
Yeah.
And what about there?
Yeah.
Okay, sorry. You're doing fabulous, well done. Is this painful here, that bone?
No.
I'm going to open his eye, we'll just shine light in his eye.
John fell at home and hit his head on a desk.
Look down for me. Look down, down, down to the floor. Perfect. I tried to open his eye to examine the eye muscles to see if there's been any damage or any fractures to the orbital floor. Nothing seems trapped. The eye muscles seem okay. That's going to need some stitches, okay?
It wasn't down to the skull. It had gone down to his fatty tissues and soft tissues, but it was quite a long cut, so it needed some sutures to bring the edges together.
Can you not see me right good? I'm on your wrong side, aren't I?
The cut isn't the only problem Chantal has to deal with. John is also diabetic and has a cancerous growth on his cheek. It's a complicated situation.
The tumour on his face is fungating and it's infiltrating, I think, to the base of his skull. So it's basically just eating away his cheek and the surrounding tissues. So now he's got this horrible head injury as well to go with it, so it's not really comfortable for him.
In great discomfort, there's a chance John could have suffered a brain injury.
We need to scan his head to make sure that there's no acute bleed or fractures, or any fractures around his orbit.
Until the CT scan, Chantal will have to keep a close eye on him. 79-year-old John is returning from his CT scan.
I'm going to put some stitches in. Have you had stitches before?
No.
No? You can tick them off your bucket list then.
An anaesthetic will help to reduce John's discomfort.
A bit sharp. Right, it'll be like a stingy bee sting, OK? Well done. Right, that should be nice and numb shortly. Right, are we ready? Can you feel anything?
No.
Good. You might feel some blood dripping into your ear, but it's OK.
I think when a patient comes in and they've fallen or injured themselves and live alone, it can be quite scary. So I think it's really important to be calm, reassuring, and being that person. If I'm calm, then you should be calm as well. And I think that's really important.
I'm thinking about keeping you in hospital for overnight.
Yeah.
Yeah, because I want the medical doctors to have a look at you to try and figure out why you've had this collapse in the first place. It may be to do with your blood sugars, because they were quite low when the ambulance crew got there. OK. Is that all right?
It doesn't take long for the results of John's CT scan to arrive.
There's no fracture and there's no bleed in your head, so that's good news.
Yeah.
OK. Good stuff. But I'm going to keep you in hospital like I said earlier. Is that all right?
Yeah.
Yeah, OK. I hope you get better.
Yeah.
And look after yourself, all right?
Yeah.
OK.
Oh, well.
Good.
I felt really sorry for John. I see a lot of patients and I don't know why certain people leave impressions on you as than other patients, but I think for John, he lived on his own. So I think if I'm a bit chirpy and can lift his spirits, it makes me feel better as well.
Hello, darling. Oh, you've made a right mess of yourself, haven't you?
Yeah.
I'm going to take you up to ward now.
Right.
Yeah?
John was kept on a ward for 16 days until he was well enough to return home.
I'm losing track of everything.
Yeah.
Over in Miners,
Shut scratch.
emergency nurse practitioner Jo is battling through the long waiting list. Her next patient is Betty, who is 90 today. She's been brought in by her nephew David.
Happy birthday.
Thank you.
You look amazing for 90. You really do, or not?
She stopped jogging on a morning.
Have you? Oh, just...
Yeah.
It says you've stopped jogging. Oh. It's been challenging wearing masks because you can tell what somebody's saying by their expression as well, can't you? Wearing a mask isn't ideal, is it? Especially if you're deaf anyway, but Betty's particularly very hard of hearing. What's happened to you today?
I've trapped my finger in bathroom.
Oh, does it hurt when I press? Does that hurt? Does it hurt? Can you feel that? Can you feel me touching you there?
Yeah, it's a bit rough.
Okay. I'm going to dress it for you then. Put your bandage on it.
Best part of this job is I come to work to socialise, really, as well as earn money. See that as an advantage in our role that, you know, we do get time to speak to patients.
Did they get you a cake? Have you had a cake?
I've got 27.
Cakes?
Cards. Cards. Which is not bad for 90.
Bring me one. Wrap it up for you.
The misunderstandings, it can be funny, and Betty luckily sees the funny side to it as well.
Because it's nice and wrapped up, it should stop bleeding now, okay?
Thank you.
So leave it for 2 days. 2 days, leave that, and don't get it wet.
I haven't got my grandma's anymore, but yeah, amazing, 90 years old and still happy and funny and making us laugh and keeping us entertained. It's great.
Try not to do too much tonight.
Yeah.
Keep it like that.
Like that?
Yes.
Yeah, I can do.
She will probably have a hot chocolate and go to bed.
Oh. Nice to meet you. Enjoy the rest of your birthday.
Yeah,
okay.
Here, I've got your handbag, Auntie.
And just
there you go. And I've got these.
There's
Your sticks there. Thank you.
Thank you.
You're very welcome. Thank you. That's amazing.
Yeah.
Lovely lady.
Patients are arriving from far and wide.
Thank you.
Bye, sweetie pie.
Really appreciate it.
One of those patients is 7-month-old Eliza. She's been rushed into paediatrics after vomiting several times at home and then falling limp.
Oh, sweetheart.
Student nurse Georgina is first to assist.
She just had her projectile. I just knew it wasn't normal because she kept like retching. And she just went a bit unresponsive at home and a bit like grey.
In a colour,
Just really pale.
It's all too much for Mum Sean.
But we've had a really horrible 4 or 5 weeks as a family.
Okay. It's okay. You're alright, Mum?
Yeah. So it started, she had bronchiolitis. Okay, and then my 2-year-old got chicken pox. And then me and my husband then had COVID and I was really poorly with it. And then Penelope had a convulsion and then
Come on.
horrible. Sorry.
Oh, it's alright, Mum.
I just feel like such a bad mom.
You're not a bad mum at all. Children get cooler, it's part of it, I promise. Come on, let's get you in the queue. I'll get you back for you.
Okay, thank you. Sorry.
Just follow me, miss.
Mum and baby are moved into cubicle 2, where Eliza's condition can be assessed more easily. But straight away,
Oh, okay. So you're on your tummy, isn't it? Alright. Okay, baby. Oh dear.
Nurse Molly is on hand.
She's been sick again.
Oh,
Like,
bless
trying to-
her.
It's like white foam, spit type stuff.
Babies bringing up foam could be a sign of an infection. So the team needs to get to the bottom of Eliza's symptoms quickly.
Is the vomit frothy or is it like really thick and white like you would with breast milk?
It was frothy.
Okay, well, her sugars are fine and she's very alert.
Yeah.
And that's the main thing at the moment. And her observations look very reassuring. The degree of worry tends to be on how do they look, are they responsive, things like that. And if they're pink and they're happy and they might be a bit grizzly, then our concern tends to drop a bit more and we just want to make sure we can get fluid in them.
Baby Eliza needs a fluid test,
The nurse is here, so I'll call you back.
where she's given regular syringes of sterilised water.
We want her to try and drink about 3.5 mils every 5 minutes or so. Okay. It'll just help us build up a picture of how much she is hydrated. That button there, that
Young babies in particular, if we get reports that they're not having as much feed as they normally do, we'd put them on a fluid challenge. We tend to find with babies is little and often we'll keep them hydrated enough that their observations improve, and also it's not enough to cause them to vomit.
What's this? It's not medicine, it's just water. Good girl.
The first syringe is a bit of a struggle, but eventually...
Good girl. Shh, shh, shh. Oh, there we go. Good girl. Good drinking. You did that quick.
Eliza's condition slowly starts to improve.
She's definitely
come round.
Yeah, she wasn't like this a few hours ago. She's smiling now.
Big smile. Ah, cute.
Mum Sian calls her husband with an update.
Hi. She's really cheered up. She's smiling now.
Sian has another daughter at home, 2.5-year-old Penelope, and she's keen to get a progress report from Mum.
Hello. Hi, baby girl. How are you?
How is Eliza?
Eliza, oh bless, she's fine, darling. She's really good. All right, we'll see you soon. Bye. Love you.
Although she's looking better, advanced paediatric nurse practitioner Liam arrives to check Eliza's chest.
Hi, is this Eliza?
Yes.
But this morning's emergency has exhausted her.
And there's been no diagnosed heart murmurs?
No.
Oh, darling, she's absolutely... Oh, I know, darling. I'm sorry.
She is a little bit red in that ear.
Is she okay?
Yeah.
Well, like I said to the nurse, I think she...
And her throat is a little bit red around it as well. So she may have just got a viral infection.
It seems the reason for Eliza's sickness has been discovered. Paediatric nurse practitioner Liam now needs to work out how to treat her.
There's a couple of really reassuring things to me.
Good, okay.
1, she's not vomiting. 2, she's absolutely smiling away at me. 3, her heart and her chest and her abdomen are really good. So what I would suggest is just keep going as you are. You're doing a fab job and you did exactly the right thing in coming in to get the checks out. It's okay, it's absolutely fine. I don't need to get you
Thank you.
But yeah, I would say take her home.
Okay.
Keep breastfeeding her. Keep giving her bits of water. If she is like that again, then just bring her back in.
We're due to go away for a couple of days at the end of the week. Are we still fine to do that?
So whereabouts are you
We're
going?
going to just to Alton Towers.
From my perspective, I'd say that absolutely go for it.
Okay, great. Okay, relieved. I'm glad we'd hopefully just go home and have our holiday. Well, hopefully, if it means we can be discharged.
With the all clear,
Thank you so much. Yeah.
Nice to meet you.
Thank you. Bye-bye.
it's time to meet Dad Matt in reception.
Oh, you're not sure who it was? Is that Daddy?
Really good. Relieved. Scary when you kind of things are out of your control.
Baby Eliza and her family made their much-needed holiday after all.